I want to remind you to continue writing questions down on cards. We'll continue to collect them all the way up through the time we begin Q&A and maybe even a little bit into it. But if we have them before we start, it leads to a little bit better flow of that session. It's my pleasure to introduce our last speaker for the morning, Joanna Frank, the founding executive director of the Center for Active Design, a nonprofit organization committed to transforming neighborhood and building design by making health a central priority. She's also been the director of active design for the city of New York. Please welcome Joanna Frank.
Oops. Thank you. Good morning. So I've had like the best setup in the world today. Normally I have to make the whole health argument as to why design is necessary, but these guys have done an excellent job. So thank you very much. So we can just get straight into talking about design. So what is active design? We are the Center for Active Design, but what does that mean? And active design is really, it's translating health evidence, the evidence that you guys all produce, and translating that into practical design solutions that designers like myself and developers and local governments can actually implement into those communities that we're so looking to affect. So active design uses the design of streets, buildings, neighborhoods, and really looks at how we can increase physical activity and food access using the design of those streets and buildings. So it's funny that we've already had the historical precedent, because this is something that we use because it gives us a lot of confidence. This is something that is actually achievable. So in the 1800s, as you all know, but my design audiences don't usually know this, the majority of the population was dying of infectious disease. And the solution wasn't one of individual health care. It was really a holistic approach to how are our cities, this is specifically New York City, how are they designed, and how are the designs of our streets and neighborhoods impacting the infectious disease rates? And in New York, the solution was a holistic solution. So we looked at infectious disease and said, okay, what can we do about the water supply? So we started creating reservoirs and piping fresh water to New York City rather than using that dirty old well water. And that instantly transformed waterborne diseases. Central Park was actually created as a working man's lung. There was a total understanding that people needed access to nature, and parks could provide this in cities that were becoming very dense. Subway system was created, transportation. Lower Manhattan was actually denser then than it is now. So how do you move people out of that downtown? How do you move them efficiently and effectively? So subways were created. And then how do you use policy? We just began to talk about policy. Policies in New York City, the sanitation department was started. Dead horses used to be left on the street to rot. Dirty water was just kind of flowing all over the place. So sanitation people started sweeping the streets and clearing that. And this had a profound impact on infectious disease. So by 1940, as we already talked about, chronic disease started to rise, and those infectious disease rates really plummeted. So chronic disease started to rise at the same time, or maybe because our built environment also started to really change. And we became a far more car-centric community, world, universe. So many policy changes happened because of that. The federal highway bill was passed, suburbs started to come, gasoline became very cheap, especially in America, and we all spread out. But in doing so, we actually stopped moving. So our physical activity rate started to drop. And we see this increase in obesity that starts to happen. So in this little graph that we've made here, this little diagram, we're seeing obesity rates rising, and we're seeing the changes in those built environments that we all live in. And we're trying to kind of correlate how is the built environment affecting people's health. And today, pretty grim picture. You guys all know this, so I don't have to talk about the health. But at the rate we're going, really, obesity and people being overweight is going to reach 86%. I mean, these are shocking numbers, especially to people who don't work in health. When I show these to developers, if I show these to designers, this is really startling news. And then those words at the bottom, that physical inactivity, has now replaced smoking as the leading cause of preventable illness in the world. I mean, this is a call to action. It's a call to action for everybody, which is why an architect, whoops, I'm going to keep doing that, which is why an architect is standing on the stage talking to health professionals. So what can we do about it? You know, how do we use the design of our communities? How do we use the evidence base that you guys are creating? How do we translate that and actually affect the way our communities look? So we can provide opportunities for transportation, for recreation, food access, not an obvious connection, but it's absolutely essential, and our built environment, the design of our neighborhoods, really does play a key role in how much access you have to fruits and vegetables. And then buildings. You know, we know, the evidence tells us that if you walk into a building and you see a stair, you are much more likely to take that stair. If that stair has a window on the second floor, I want to go and see what that view looks like. We know what motivates behavior. We understand how to entice people, how to make it desirable to walk down the street, how to make it desirable to cycle. You have to provide safe communities. You have to provide safe environments. But you also have to provide environments that actually trigger our behavior. And with active design, we're talking about daily routines. We are not talking about going to the gym. Going to the gym is fantastic, but what we are talking about is your daily routine. Walking to work, walking to your school, going out in the afternoon and playing, you know, volleyball. This is New York City, actually, playing volleyball in New York City. How do we provide those opportunities? I'm not telling you you have to walk. I'm not telling you you have to cycle. But if you don't have an opportunity and if you don't have a safe, well-designed place to do that, you really don't have a choice. And that is what this is about. So we started by looking at how to affect levels of physical activity in daily routines, but through working actually with the Colorado Health Foundation and the Urban Land Institute, who I believe those of you who were here last year heard from, we've actually been the expert content advisor to the Building Healthy Places Toolkit, which if you joined me for yesterday's workshop, you had a little taste of how to actually to take these design strategies and look at how to implement into a community. And what we were able to do with this publication is to do a really extensive literature review, which went beyond just physical activity and actually looked at the evidence base around a broader set of health indicators. This actual publication was really written specifically for real estate developers. So I think that's something that's also essential, is that everything we do has to resonate with the people that we're trying to address, the audience that we're trying to reach. So if you're a real estate developer, and I used to be a real estate developer, so I know this, you have a very specific set of motivations. Maybe it's market differentiation, it's certainly financial, it's certainly a return on investment, and you have to be able to fund it. Otherwise, it doesn't matter, it's all talk. So how do you provide the tools that real estate developers need? So this poster, you may have seen it, it's around. These are 21 recommendations. And these 21 recommendations are all kind of big picture design decisions that are specifically within the purview of real estate developers. So we're not talking about a city crosswalk. We are talking about what the developer can actually affect, the change that they can make with their portfolio. Each one of these recommendations has either 2 longitudinal or 5 cross-sectional studies behind it. And that doesn't matter particularly to developers, but it matters to us. It matters that this is credible and that this is based in evidence. This is not just a good idea. This isn't just something that we've dreamt up and decided it's going to make a big difference. So these recommendations are then supported with actual design strategies, which either have evidence behind them or are best practice, because that evidence base is still emerging, which is where we need you guys to continue to create more evidence. But really, that's jumping ahead of the story. So those toolkits are a set of guidelines, which actually you can pick up. They're out on the resource table. These are tools, but they're part of a larger process. So I can't just wave my toolkit around to you guys and say, okay, go out there, go figure it out. Here are the tools. You can do this. That's not going to work. The magic happens when we all work together. It's a process. It's not an easy or linear process. It can be very messy, but we do have a process in how to engage the community and how to really create effective, measurable impacts. So this is a process that we've developed. We work the same way if we're working with a community, a developer, a local government. The process is the same. The outcomes are always different. So let me go through this. I'm actually going to use a real-life example of how this works so that you guys kind of have an idea really about implementation. So assessing needs and opportunities, that's something we've heard a whole lot about. So you guys are very well equipped to understand what are the health needs of your community. That's your perspective. The community is going to have other needs that it wants addressed. They may be economic. They'll certainly be about equity. And then what are the opportunities in that community? Every community has a unique set of opportunities in their built environment, in their streets, in their density, and so on. Identify partners, we talked about that, and also your partner's priorities. And then implement design strategies, that's where the toolkits come in. Planning for the long term, this is not a quick fix. Yes, it needs to be big, but it will take time, and we have to be patient, we have to understand there will be setbacks, but that's okay. That's all part of the process, and you have to anticipate it. Working in New York, we've had lawsuits, we've had demonstrations. You know, it's okay. I'm a developer, right, so we're used to lawsuits, but it's okay. So then measuring impact. Measuring impact doesn't really come at number 5. Measuring impact really starts at number 1 and continues all the way through the process. Because if you can actually demonstrate that what you're doing is effective in real numbers, in real data, you're going to go a long way to persuading your naysayers that this is effective. You're also going to know what isn't working, and that's essential. Like, not all of this stuff is going to work, and you need to be able to change course. But you won't know exactly how it's working unless you measure it. So very important to measure it, evaluate it, continue to do that. And it's an integral part of the process. It isn't an add-on. It needs to be fundamental. And then celebrating success. I'm all about having a party. So we're going to look at this real project. It's in Tulsa, Oklahoma. I didn't choose a New York City one because, you know, it's sometimes hard to see how it will relate to other parts of the country. So Tulsa, Oklahoma has a unique set of needs and opportunities. So this is a project. It started life as that top picture, which was a truck loading dock. So the needs of the community were that there were big health disparities. So the childhood obesity rates in Tulsa are some of the highest in the country. This particular neighborhood is actually, this site is a confluence of 3 different communities, all of whom are low income. And then the neighborhood itself had this opportunity. There was this truck loading dock, which was no longer going to be used. However, it's a brownfield, opposite of greenfield. It's a brownfield site, which means it's contaminated. It means that the ground underneath that loading dock probably has petrochemicals and who knows what else. So these are your needs and opportunities. So you have a site and you have identified needs that you want to address with a project. So then comes identifying partners. So this project was actually led by the George Kaiser Family Foundation. And for them, this was an innovation, because up to then, they had a part of their mission about health care, so traditional health care, out of healthcare providers. And they had another program which was around breaking the cycle of poverty. And what they were able to do with this project is that they brought those 2 missions and they brought them together, because they really actually definitely go together with the built environment. So they were able to do something innovative for themselves. They then found a very talented design group who were also very much kind of across many sectors of design. So not individual silos of design, but you had the kind of a whole spectrum: planners, landscape architects, designers. And then they also worked with a community outreach group who actually were able to communicate with the local business community and really facilitate community engagement. So once you have your partners, it's really important that you're equal. We've talked about this. This is not a top-down approach. Everybody has something that they're bringing to the table. Everybody is an essential piece of the puzzle. And really, you need to understand what are your priorities and what are their priorities. Because you don't all have to have health priorities to come up with a fantastic new built environment. Many of the design strategies that we recommend have many synergies. They have economic development synergies. They have universal accessibility synergies. They have equity synergies. And they have economic development, environmental sustainability. So you can address multiple different priorities with a single design strategy. But it's important to know what they are. Like, put them on the table. Be frank. What are you trying to achieve with this project? You know, this is what we're trying to achieve with this project. Everybody's motivation is going to be different, but it's okay. They can all coalesce together, and you can set this shared vision, which we kind of talked about before. Now come the design strategies. So you have this unified vision of, like, this is what we're trying to achieve. This is what all the people together are trying to achieve. How do we translate all of those outcomes, all of those desired outcomes? How do we translate those into these design strategies? And this is where we come in. This is our job. This is our role. We do that with the toolkits and so on, but we also do that for individual projects. So you have an obesity prevention agenda. So let's include a farmer's market in this new space we're creating. Local business wants to be included. Let's bring some food trucks in. This neighborhood lacks food access. Physical activity. Let's get people to be more physically active of all generations by creating this built environment, which, again, it entices people. I want to do that nature walk because it looks really beautiful. It's appealing to many of my senses. I want to experience that. I'm not doing it because you're telling me it's healthy. I'm doing it because I want to. I want to walk along that path. Economic development, essential that this is viable. It's essential that communities are economically viable. And it's totally fine that that goes with health. It absolutely goes with health. So bring in the local business. Have them be the vendors in your space. Have them provide the programming for your space. Have them partner with you in finding the grant money, looking at local business, local government to secure funding. There's a lot of money out there. I mean, there really is a lot of money. You just have to know how to appeal to those different pieces of funding to bring it together. And then environmental sustainability. You know, the brownfield site is now a bioswale. I mean, what a fantastic story. I mean, that in itself could be a whole discussion, you know, and that takes vision. And they have actually done this. This is not a hypothetical. This is had, you know, this is a real project. And then planning for the long term. You know, these things, they take time. They definitely take patience. They take vision, leadership, energy. When we talked about people being fatigued, get over yourselves. Don't be fatigued. Come on, you've got to just, you have to keep doing this. What's the point otherwise? It's going to take all of us to do this. I can't necessarily do the Zumba at 10,000 feet like they were yesterday, but I do feel like there's so much talent in every room that we ever speak to. There's the ability to make huge differences in everybody that you speak with. And so we really need to just kind of harness that energy. An essential piece of the built environment is supplementing it with programming. Now, we've talked a lot about programming. Programming is not what we do. We provide the space that allows that programming to happen. We provide the spaces that can serve many, many functions. And that's what good design can always do. You also really want to look at how do you program and how do you design space for all ages and all abilities, because that just brings vibrance to the place. It will help to add that sustainability. It will add that long-term use. You have to reach the people who actually want and need these services. You have to respond to the demand. There's no point me building a park if there's already 3 parks in the neighborhood and nobody wants a park. You have to know what's needed and what's demanded. And you do that by listening, you do that by looking, but you also do that by talking to the people who live in the community. They know what they want. And then measuring impact. We've talked about that. This is something that you guys are probably the most familiar with. But count everything, because you never know what number you may want to draw on in order to be able to talk to a local politician or a local funder or a national funder or an international funder. You know, gather all that data. It can be so useful. It really helps to tell the story. You know, if I can tell you that I've had 10,000 visitors coming to this space, and each one of them has stayed for an average of this amount of time, I can begin to extrapolate what that looks like as a health impact. So you want both short-term wins, so you can talk about it, and you can keep everybody motivated, and you can make sure that people understand that this is being effective and continue to build that momentum. And then you want to understand the long-term implications, because health is tricky and it's long-term. So what are the shorter-term impacts you can look at, like physical activity rates, people walking down the sidewalks, you know, increased amount of physical activity, increase fruit and vegetable intake. So how do you then extrapolate that into a longer impact on health? Voting rates, very interesting to see if people begin to be more engaged in their community, are they then translating that into being more engaged in the civic part of their society, and then economic impact. Obviously, we know how to quantify that, and that's very important. And then celebrating success. So this project actually won the Center for Active Design Excellence Award this year, which is why we know so much about it. But it's really important that we lift up our successes and we celebrate everything. Because this is, you know, it's tough and it takes a lot of energy and it takes a lot of inspiration. And even if it's a small success, you need to celebrate it because you never know what, you know, obstacle is going to come down the road. So really important to celebrate success, the small and the huge. So that's that case study. So that's how to do it. And now here's a project that is just starting. And this should actually hopefully resonate with you guys, the people who are running healthcare institutions. So this is the beginning. There haven't been big impacts. I can't show you pretty pictures, but it's a great story. And as this is all about storytelling, I'm going to tell you this story. So Gundersen Health System is in Crosse, Wisconsin. It is a very large health institution. Behind the health institution is the Mississippi River. In the foreground here is an existing neighborhood with kind of older houses, a stable population, but a population that is aging, middle income, nothing particularly extreme about their health statistics. So the reason this is an interesting story is that Gundersen has been growing. And as they grow, they have increased the amount of surface parking, as you can see from this picture. A lot of surface parking. And so there was beginning to be friction, or growing friction, between the health institution and the neighborhood, the surrounding neighborhoods. The surrounding neighborhoods were also beginning to deteriorate. Their public realm was deteriorating. So their sidewalks were beginning to deteriorate. The lighting, the street lighting, was beginning to feel unsafe in this community. So the community started to be kind of, it began to be a hostile relationship between the community and the hospital, especially because the hospital wanted to grow further. So there beginning to be local resistance for the hospital to grow. And understanding motivation is really important. So the hospital was basically forced somewhat to start to engage with the community. And this was facilitated by the local government. And so the community, the hospital, and the local government all got together and started talking about everybody's needs, everybody's priorities. And so it transpired that they were pretty simple. So the community that was living adjacent to this hospital wanted to reach that river, but the hospital had become a big barrier, and they could no longer walk to the river. So that was one of their biggest kind of issues with the hospital. It had become this barrier. The hospital wanted the surrounding neighborhood, the deteriorating public realm was actually beginning to negatively impact the perception of the hospital and also the happiness of their staff and patients, because the staff of the hospital wanted to walk to downtown, but to walk to downtown they had to walk through this neighborhood, and the neighborhood no longer felt safe. So they no longer felt like they could walk to the downtown. Then the other thing that emerged was that this neighborhood was actually a food desert. There was no access to a grocery store within walking distance. This is a kind of a population that's beginning to age. Very important that they can walk to the grocery store. There is no grocery store. The reason there isn't a grocery store is that there wasn't enough density in that population to actually support a grocery store. But if you combine the density of that population with all the people working in the hospital, suddenly it's viable for a grocery store. So there's a solution there that's kind of nicely married. And then the hospital discovered, or was reminded, that they actually owned a number of lots that were in that existing neighborhood. And so they started to develop those lots as housing for their residents. So they began to be really actually engaged in the built environment of that adjacent neighborhood and started to advocate, or are starting to advocate for improvements to the built environment. So there you have this kind of small little window of how all of these pieces can come together, and the different priorities of the health institution and the community and the local government can actually, there can be synergies between the people. And really, it's not rocket science. This is really not complicated, but it takes a will and it takes a motivation and it takes a vision to actually begin to engage with the communities, especially as a very large institution. What is interesting about health institutions, as opposed to other businesses, is you are a permanent member of that community. You're not going to move. You're not a business that can just suddenly go find tax incentives in some other state. You're there. You're going to stay there. And so I feel like you do have this unique role that you are part of the fabric of the community that you serve and that the community that you are within. And it's in your benefit also for the surrounding community to be healthy. And I'm sure we can make an economic argument as well around your staff health, patient health, and family health as to the family of the patients if there are opportunities for physical activity and access to food within close proximity or within the hospital campus itself, that, I'm sure we can monetize that if that's what's needed to make this argument even stronger. So this is kind of the first little piece that's happened, is that some of that parking lot is now a walkway. They're beginning to create a walkway to that river as a first step. This is going to be a long process, but this is something that, there's a tangible first step. There's trust starting to be built, that people are listening. And so this is a great kind of in-progress example of how this can work. So just kind of a refresher, this is our process, but it certainly translates to healthcare providers. It's something that we can all use. And that's it, guys. Thank you very much.